Well, back in May, Iowa Governor Kim Reynolds signed off on a bill aiming to bring more doctors into the state, especially in rural communities where that need is greatest. KCAU-9 reporter Tyler Euchner spent his day at a local family medical clinic and now shares more on the numbers of soon-to-be doctors working at the facility.
Thanks, Tim. The new bill will use federal funding to create around 115 new residency slots in places just like the University of Iowa Family Medicine Center in Sioux City.
Residency is the time after a medical student graduates from medical school and they decide what specialty in medicine they're going to go into, and then they're placed into a residency and they complete their training there in that specific specialty.
The University of Iowa Family Medicine Center brings in soon-to-be doctors and trains them on a variety of fields, from clinic visits to even delivering babies.
We have 6 residents in every class that comes in. It really is a guideline that's given by the ACGME, which is our accrediting body, that tells us how many residents we can fill. But we have a possibility for 18 total residents here at a time.
However, the Family Medicine Center hasn't been able to completely fill those slots in a while.
There are some issues in family medicine in general that less people are applying to family medicine and more people are going into specialties. So that's one of the focuses that we have, is trying to get people excited about family medicine.
Dr. Drew says this new bill could help rural communities, which many are in desperate need of doctors. According to a 2024 report, rural Iowa has 17% fewer physicians compared to urban areas.
We need people to not have to travel long distances to go see their primary care doctors, because we really focus on prevention and keeping people healthy. If we don't keep people healthy because they, lack of resources, because they don't have those physicians or other providers in those areas, they just don't seek care.
Dr. Drew says that roughly 80% of residency students do stay local, but doesn't know what this new law will look like for them and other facilities.
The Iowa Department of Health and Human Services will really direct what that means for us. I don't have a lot of insight into what long-term it's going to mean for us, but there's lots that go into residency spots and being able to train residents outside of just having the slots available for them.
According to the Association of American Medical College, in 2023, Iowa was ranked 44th in the nation for patient-to-physician ratio, with only 233 doctors per 100,000 patients. In Sioux City, Tyler Euchner, KCAU-9 News.